Hi friends, welcome to Plexus Ortho. Today we are going to deal with a topic called as Osteogenesis imperfecta. We are going to focus for the NEET PG exam, and it's going to contain a little bit of pathology and orthopedics as well. It's a very often asked question in your exam, so you should make sure you get a question or two about this right, and we always get one or two questions about osteogenesis imperfecta in every cycle. So make sure you know the topic very well so that you don't miss any questions with regards to this topic. It's also called as brittle bone disease. Remember that. It is also called as brittle bone disease. Another unusual name for it is also Lobstein-Rollix disease. I hope they don't ask you this, but this just keep it in the back of your mind. It's also called as Lobstein-Rollix disease. Brittle bone disease is very commonly asked. Marble bone disease is different from brittle bone disease. Marble bone disease is excessive bone formation, failure of osteoclastic activity, and therefore the bone becomes more dense, and this is called as marble bone disease. And marble bone disease is not osteogenesis imperfecta. Remember that. Marble bone disease is not osteogenesis imperfecta. So what is osteogenesis imperfecta? It's a qualitative, not a quantitative. The quantity is normal, but the qualitative defect in the type 1 collagen formation. The same thing we remember between osteoporosis and osteomalacia. Osteomalacia is a qualitative defect, whereas an osteoporosis is a quantitative defect. So here it is a qualitative defect. There is a mutation in the type 1 collagen gene, and there is a problem in the type 1 collagen gene formation. And this is called a COL1 gene or COL gene or collagen 1 gene. So when a mutation occurs in this gene, it causes a defect in the formation of collagen type 1, which is very important for bone. We all know that bone has 1 in it, ONE1, and therefore type 1 collagen is the most important collagenous portion of the bone, and it is a very important component for the structural integrity of the bone, skin, ligaments, and other tissues as well. So it affects all kinds of tissue, but mainly affects the bone, and therefore it causes multiple fractures because the bone becomes very weak. Right, so it is most commonly inherited in the autosomal dominant fashion, which is the most common form of inheritance. Of course, it is inherited in other forms. It is inherited in other fashions as well, including autosomal recessive and non-Mendelian fashion as well. But for your exam purposes, in a question, you must always stick on autosomal dominant. Autosomal dominant is the most common form of inheritance in osteogenesis imperfecta. So what are the clinical manifestations? The clinical manifestation most importantly is repeated fractures. Repeated fractures after minor trauma. So if there is a child, if there in the clinical vignette, you have a child with minor trauma having multiple fractures, you should suspect osteogenesis imperfecta. These multiple fractures can occur in utero as well, and they can occur immediately after birth and up to the stage of adolescence. Beyond adolescent and teenage age group, the number of fractures decrease, and it becomes better. Again, there is a higher incidence of fractures after menopause. So once the child crosses the adolescence and teenage age, the number of fractures and problems decrease. The lower limb is far more commonly involved than the upper limb because it is a weight-bearing portion. In the lower limb, the femur bone is much more commonly involved than the tibia bone. And all other bones in the body can be involved, including the humerus, forearm, the skull. But among all these, the lower limb is the more common one, and the femur is the more common among the lower limb bones. And because the ligaments are also involved, you can have ligamentous laxity as well. You can have a repeated dislocation of the hip, repeat dislocation of the patella, repeated dislocation of the radial head as well. So multiple dislocations can also be seen because of muscle imbalance, and the strength of the ligaments are reduced, and therefore you have a higher chance of dislocation because of this. Okay, you also have what is called as Vermian bones. Vermian bones are seen in multiple disorders, but it is seen very frequently in osteogenesis imperfecta. It is seen in the suture line of the skull. It is seen in the suture line of the skull. You have multiple fragmentation of bone at the level of the suture line. Here, this is the lambdoidal suture line in the skull, and when you see this multiple fragmentation of bone in this suture line, it is called as a Vermian bone. It is seen in multiple conditions, but the most significant condition for your exam that may be asked is osteogenesis imperfecta. What are some of the non-orthopedic manifestations? Then some of the non-orthopedic manifestations are very predominantly seen in the eye, The eye features you can see is a blue sclera, because the blue sclera, the conjunctiva is very thin because the collagen is malformed. It is translucent or transparent, and therefore you can see the pigment in the underlying uvea, and therefore you see this blue sclera. So underlying uvea is seen through the translucent collagen of the conjunctiva, and therefore you see the blue pigmentation or blue sclera. This is a very frequently asked question. It's a short marks for you if you get it right. So therefore you must remember blue sclera and osteogenesis imperfecta. The other things that you can see is called the Saturn's ring, which you can see around a white color ring around the cornea. It is called a Saturn's ring, which is also seen in osteogenesis imperfecta. Hyperopia and retinal detachments are the other ophthalmologic manifestations seen in osteogenesis imperfecta. Hearing loss. Hearing loss is a very frequently seen problem. Hearing loss could be conductive loss because of otosclerosis, because the bones of the middle ear are also involved in case of osteogenesis imperfecta, and it can be a sensory type due to compression of the eighth nerve when it is coming out from the skull. So it could be conductive or sensory, but could be a mix of both of them as well. 50% of all patients with osteogenesis imperfecta have a hearing loss. Don't forget that. Teeth, the dentogenesis imperfecta is a term used for it. Teeth are often very commonly involved. The enamel is preserved because it is from the ectoderm and not from the mesoderm. The other teeth, both the deciduous and the permanent teeth, are involved. They undergo fractures. They have caries. The lower incisors are more commonly involved in case of osteogenesis imperfecta. So the teeth and the mouth are a common location where the osteogenesis imperfecta has clinical manifestations. Now coming to skin and muscle, the skin is very fragile because we know collagen is required for the skin formation as well. When you have poor quality of type 1 collagen, it becomes fragile. You have subcutaneous hemorrhages. It is translucent, easily damaged. Wound happens very easily. The muscles become hypertonic, right? And because of improper or imbalance of the muscle and bone, multiple fractures occur, and the place where the tendon joins the bone becomes weak, and there you have fractures as well. So the overall balance between the muscle and bone is disrupted, and therefore you have multiple fractures and injuries occurring to the structures. Now you also have malignant hyperthermia, which is also seen in osteogenesis imperfecta. You have excessive sweating. There is a heat tolerance. So therefore they are more likely to have heat strokes and malignant hyperthermia. How do you diagnose osteogenesis imperfecta? You need a genetic diagnosis. To get a proper diagnosis, you need to incubate the skin fibroblasts and do a gel electrophoresis using PCR technique, and then you can identify the COL gene or COL1 gene mutation, which is seen in these conditions. Of course, radiographs kind of confirm the multiple fractures that are seen in various stages of healing. Multiple fractures in various stages of healing occur only in two conditions, one in child abuse and the second one in osteogenesis imperfecta. So these are the two differential diagnoses when you see multiple fractures. One is child abuse and the second one is OI or osteogenesis imperfecta. You see radiographs with fractures in multiple locations in various stages of healing, and this is called as the osteogenesis imperfecta. There is a mildly elevated alkaline phosphatase because the bone is trying to repair these fractures. The healing time of these fractures are normal, but there are multiple locations where the healing process is taking place, and therefore alkaline phosphatase, which is a marker of bone formation, which is released by the osteoblast, is elevated mildly. What are other conditions it is elevated? It is elevated very highly in case of osteosarcoma, where a large amount of new bone formation is occurring. So mild elevation of alkaline phosphatase is one of the diagnostic features of this condition. Then what is the treatment options? Treatment options, of course, the best way to treat it is gene therapy. Nowadays new therapeutic modalities are available, and gene therapy has been tried out to replace the COL1 gene and therefore to produce normal type 1 collagen. The other treatment that is used to prevent fracture formation is the use of bisphosphonates. Bisphosphonates, the indication of bisphosphonates is osteoporosis, less than minus 2.5 T score. You use bisphosphonate as the first line of drug. However, if you have children with osteogenesis imperfecta, it has been shown that pamidronate reduces the fracture rate by decreasing osteoclastic activity and therefore increasing bone formation. So this is one of the few indications where this bisphosphonate is used in children, and the drug of choice in this case is pamidronate. The drug of choice of bisphosphonate for osteogenesis imperfecta is pamidronate, which is usually given in intravenous fashion. So it is pamidronate, don't forget that. So that is in brief about osteogenesis imperfecta. It is usually autosomal dominant, also called as brittle bone disease, and it is a mutation in the COL1 gene. There are multiple orthopedic and non-orthopedic clinical manifestations. Treatment is symptomatic. When you have fractures, you kind of try and fix them with some kind of rods or plates. Make sure that they do not fracture again. Take care of the patient. So these are the things that you have to do in case of osteogenesis imperfecta. Now let's go through 3 questions which have been asked previously in your NEET PG exam, and make sure that you understand the topic appropriately. So let's go through this first question. Osteogenesis imperfecta, true is. So they're asking what is the true statement in this. It is marble bone disease is another name of it. No, we know brittle bone. So brittle bone is the one which is called as osteogenesis imperfecta. Marble bone disease is excessive bone formation and poor osteoclastic activity. So therefore this is the wrong answer. Hyperlaxity of ligaments with hypermobile joints, yes, because collagen 1 mutation not only affects bone, it affects the skin, ligaments, capsule, sclera and other structures as well. Therefore you can have developmental dysplasia of the hip, patellar dislocation, radial head dislocation. So various dislocations and hypermobile joints can be seen. So this looks like a true statement. Let us look at the other 2 options. Cranial nerve compression does not occur. Cranial nerve compression does occur. The 8th nerve may be compressed when it is coming out of the brain, of the skull, and therefore cranial nerve compression does occur. Treatment involves bone marrow transplantation. No, the treatment involves gene therapy and bisphosphonates. Bone marrow transplantation doesn't make a difference in case of osteogenesis imperfecta. Let's go to the second question. Prenatal determination of osteogenesis imperfecta is done by. So prenatal determination can be done by genetic methods, and we can look for the alpha chain problem in the collagen. So it is a collagen 1 alpha mutation, right? COL1 mutation, and that can be identified by abnormal pro alpha chain. So therefore the correct answer is option number 3. Acid phosphatase has no relation with osteogenesis imperfecta. Alkaline phosphatase has no relation, and FGFR3 mutation we know causes achondroplasia and no relation with osteogenesis imperfecta. All the following are features of osteogenesis imperfecta except. So all the following are features of osteogenesis imperfecta except blue sclera. We just discussed, yes, because the uvea has a blue pigment and the collagen becomes translucent and thin, and therefore the pigment shows up and therefore it is blue in color. Multiple fractures, definitely this is one of the mainstay features of the osteogenesis imperfecta. Cataract, I don't think we see cataract in cases of osteogenesis imperfecta. Hearing loss, of course, because of conductive and sensory, that is otosclerosis and compression of the 8th nerve, and therefore you have a hearing loss. So the correct answer here is cataract. Cataracts are not seen in cases of osteogenesis imperfecta. So these 3 are the sample questions with regards to the topic of osteogenesis imperfecta. Hopefully this topic is clear for you, and hopefully you liked what we put up. Please do come back for more videos. My name is Dr. Kanan Kumar and this is Plexus Ortho. Thank you very much.